Hello everyone. Today the topic is about enzyme inhibition. A substance which binds with the enzyme and brings about a decrease in its catalytic activity of that enzyme is called as enzyme inhibitor. There are three types: competitive inhibition, which is reversible; non-competitive inhibition, which is irreversible; and uncompetitive inhibition, which is also irreversible. And in addition, we also have suicide inhibition and allosteric inhibition. So any substance which is binding with the enzyme and decreasing its catalytic activity is called as an enzyme inhibitor. First is competitive inhibition. So inhibitor binds non-covalently and the binding is reversible. Hence the name is reversible inhibition. So inhibitor, it closely resembles the substrate. If you see the shape of the inhibitor, it is similar to the substrate, and that is why it is called as substrate analog, both of which compete for the active site of the enzyme, and that is why it is called as competitive inhibition. And if we increase the substrate concentration, this particular binding of the enzyme with the inhibitor is reversible. That is why it is called as reversible inhibition. Relative concentration of the substrate and inhibitor and their respective affinity with the enzyme determines the degree of competitive inhibition. So more the substrate concentration, this binding will become reversible. Now this inhibition can be overcome by a high substrate concentration. So in competitive inhibition, the Km value increases whereas the Vmax remains unchanged. If we increase the substrate concentration to reach the same maximum velocity, that particular inhibition is reversible. So that is why it is called as, so that's why it is said that Km value is increased whereas Vmax is the same in competitive inhibition. Example for competitive inhibition is succinate dehydrogenase and malate dehydrogenase reaction. So structure of succinic acid resembles malonic acid. If you see malonate and succinate, both of them are structurally similar. So succinate dehydrogenase, instead of acting on succinate, this malonate will bind as an inhibitor, and you will not see the reaction proceeding forward. So malonate acts as an inhibitor of this particular reaction, succinate dehydrogenase, because both of them are structurally similar. Clinical importance of this inhibition: sulfa drugs, which are used as antibacterial drugs. So bacterial folic acid, pteridine plus para-aminobenzoic acid, they form dihydroteroic acid and dihydrofolic acid, which in turn will form tetrahydrofolic acid, and this tetrahydrofolic acid is required for its bacterial growth. And this sulfa drugs, they are structurally similar to this para-aminobenzoic acid. This para-aminobenzoic acid is required for its tetrahydrofolic acid, which is ultimately required for the DNA synthesis of the bacteria. And this sulfa drug, it is structurally similar to para-aminobenzoic acid, and that competitively inhibits this PABA so that the new DNA is not formed and bacteria is degraded or it undergoes destruction. So that is the importance of the competitive inhibition in clinically. Similarly, methotrexate, which is an anti-cancer drug. Now this folic acid is required for purine synthesis and pyrimidine synthesis, and methotrexate, this acts as an competitively inhibitory. The inhibits the enzyme dihydrofolate reductase so that DNA and RNA synthesis is inhibited, and therefore it acts as an anti-cancer drug so that the cell replication stops. Antimetabolites or antivitamins, they block metabolic reactions by competitive inhibition and used in the treatment of cancer and gout. So there are many examples of competitive inhibitors: xanthine oxidase, which is used in gout; monoamine oxidase, which is required for increasing catecholamine levels; dihydrofolate reductase, that we have seen, it is used in the treatment of cancers and leukemias. And then acetylcholinesterase, dihydroteroate synthase, vitamin K epoxide reductase, and HMG-CoA reductase. These are all the different examples of competitive inhibitors. Next is non-competitive inhibition. This molecule binds to other site other than active site. Now in competitive inhibition, we have seen that the inhibitor binds to the active site. Now in non-competitive inhibition, it binds to other site. This causes a conformational change in the enzyme and substrate cannot bind. Now here inhibitor is not a substrate analog. It is not structurally similar to the substrate, and increasing the substrate concentration will have no effect on the inhibitor, and that is why it is called as irreversible. So if you see, the inhibitor is not structurally similar to the substrate, so it is not a substrate analog, and it binds to other site. It is not binding to the active site, but it is binding to other site, and therefore the reaction will be stopped. You can call it as allosteric site that binds to the allosteric site, and therefore any increase in the substrate concentration will have no effect on the reaction, and therefore this particular inhibition is irreversible. For non-competitive inhibition, the Km value is unchanged, whereas Vmax is lowered. So for the same substrate concentration, even if you increase the substrate concentration also, there will be no effect. So the Vmax is decreased. Non-competitive inhibition is irreversible inhibition. The inhibitors bind covalently with the enzymes and inactivate them, which is irreversible. These inhibitors are usually toxic poisonous substances. So the inhibitors that usually act through non-competitive inhibition are poisonous substances. Examples: iodoacetate that inhibits the enzyme papain and glyceraldehyde 3-phosphate dehydrogenase. Diisopropyl fluorophosphate inhibits serine proteases or acetylcholinesterase. Penicillin antibiotics inhibit serine containing enzymes. Organophosphorus insecticides that inhibit acetylcholinesterase. Next is uncompetitive inhibition. Inhibitor binds to the enzyme substrate complex, not to the free enzyme. Now here both Vmax and Km are decreased. So this particular inhibitor is binding to the complex, the enzyme substrate complex, and not to the individual enzyme. And you will see the decrease in both Vmax and Km. Examples: anticonvulsant drugs, valproate, or anti-cancer drugs, camtothecin. Now, suicide inhibition is a specialized type of irreversible inhibition where the original inhibitor is converted to a more potent form by the same enzyme that ought to be inhibited. For example, allopurinol in gout that is used to decrease uric acid production. So, purine basis hypoxanthine is converted to xanthine, and xanthine is converted to uric acid by the presence of the enzyme xanthine oxidase. Now, allopurinol is given as a drug, and this allopurinol is converted to alloxanthine by the same enzyme, that is xanthine oxidase, and this alloxanthine will inhibit xanthine oxidase, and this is called as suicide inhibition, so that uric acid production is stopped or it is decreased. So the original inhibitor is converted to a more potent, so this is the inhibitor allopurinol, it is converted to a more potent inhibitor, that is alloxanthine, by the same enzyme, and that needs to be inhibited. Xanthine oxidase is the enzyme that needs to be inhibited, and this particular enzyme converts allopurinol to alloxanthine, and this alloxanthine will in turn inhibit xanthine oxidase, so that uric acid production is decreased or stopped, and that is called as suicide inhibition. So the differences between competitive and non-competitive: competitive acts on the active site, non-competitive doesn't act on the active site, or may not. Structure of the inhibitor: it is a substrate analog in competitive inhibition. It is not a substrate analog, it is unrelated molecule. Inhibition is reversible in competitive, it is irreversible in non-competitive. Excess substrate inhibition is relieved, whereas there is no effect on the non-competitive inhibition. Km is increased, whereas Km there is no change. Vmax there is no change, but Vmax is decreased in non-competitive inhibition. Significance: drug action is usually seen in competitive inhibition, whereas toxicological or poisonous substances act through non-competitive inhibition. Next is allosteric inhibition. We have seen that any substance which is binding to other site other than active site is called as allosteric inhibitor, and if it is decreasing the enzyme activity, it is called as negative allosteric modulator. Salient features of allosteric inhibition: inhibitor is not substrate analog, It is partially reversible where excess substrate is added. Km is increased, Vmax is reduced, and effect of allosteric modifier is maximum. So that is what is about enzyme inhibition. Competitive inhibition, inhibitor binds to the active site of the enzyme and it is structurally similar. It is called as a substrate analog and it is reversible. Non-competitive inhibition, the inhibitor binds to a different binding site. It is not structurally similar and it is not a substrate analog and it is irreversible. Uncompetitive inhibition, the inhibitor binds to the enzyme substrate complex. It doesn't bind to the individual enzyme. It is not structurally similar and it is also irreversible. And competitive inhibition, Vmax is unchanged, Km is increased. Non-competitive inhibition, Vmax is decreased, Km is unchanged. Whereas uncompetitive inhibition, both Vmax and Km is decreased. Thank you.